This is Dr. Kristen Samuelson presenting on concussion assessment and management for primary care providers. The purpose of this training is to provide primary care providers with information surrounding the assessment and management of cognitive and psychological symptoms resulting from mild traumatic brain injury or concussion. The training will include 3 modules. The first is assessment and diagnosis of concussion. The second involves cognitive and psychological symptoms related to concussion and common comorbid conditions. Finally, the third module involves management of long-term cognitive and psychological post-concussive symptoms and when to refer. This training will also include assessment tools, referral lists of providers in Colorado, and downloadable patient handouts. We will also provide a video of a practitioner modeling psychoeducation about concussion for patients. The training will not cover management of mild TBI in the acute phase, meaning less than 7 days post-injury, or management of moderate or severe TBI. We'll also not discuss in detail physical symptoms of TBI or the physical examination. Our focus is on the types of patients primary care providers typically see and on the area that they might have inadequate prior training, patients post-acute phase, and the management of persistent post-concussive cognitive and psychological symptoms. Primary care providers often note that they have sufficient training to diagnose and treat physical symptoms related to concussion, including headache, dizziness, and vision, hearing, and olfactory symptoms. However, they often find their training lacking in the diagnosis and management of psychological and cognitive symptoms related to concussion, or knowing when to refer versus when to manage in primary care. In addition, a significant amount of knowledge and research has accumulated related to concussion and TBI over the past 10 years, following the branding of TBI as the signature injury of the wars in Iraq and Afghanistan, as well as increased recognition of the impact of multiple concussions in professional athletes. Consequently, we've noticed that what we know about TBI now is much different than what we knew 10 years ago. We hope to provide information about current research and trends in the TBI world in this training. Before beginning, it's important to highlight the crucial role PCPs play to patients after a concussion. Primary care providers are typically the first point of contact patients have after sustaining a head injury, and patients may seek them out not just for physical symptoms, but for cognitive and psychological symptoms as well. This may be for several reasons. Perhaps the patient lives in a rural or underserved area without access to mental health care. In these scenarios, PCPs may be required to provide education across disciplines to a patient coming to them with questions outside of their scope of practice. These include concerns over the long-term impact on their cognitive abilities. Even in areas in which access is not a barrier to mental health care, patients may not be aware of the resources available. A PCP's ability to provide information and referrals for additional resources regarding mental health and well-being can have a profound impact on patient recovery. Being the first point of contact for patients also allows PCPs to reduce stigma surrounding mental health. It's not uncommon for patients to come to their primary care providers for support for their concerns regarding mental health, given their history of pre-existing trust and rapport with the primary care provider. A provider's reaction impacts not only what the patient will be willing to disclose in the future, but also his or her own thoughts and feelings regarding the patient's symptoms. More information regarding confronting stigma around mental health will be available throughout the training.